Hello everyone, welcome to my channel. I am dietitian Suparna and here I am to share my knowledge with you all. Every year, the first week of the August month is celebrated as the World Breastfeeding Week. This year, the theme of World Breastfeeding Week is Support Breastfeeding for a Healthier Planet. We all know that breast milk is the miracle food for the baby and breastfeeding is a beautiful phenomenon of life. So let me take the opportunity to explain this beautiful phenomenon of life. The content of this beautiful project has been created by Sayantika Saha, Debjani Bannerjee and me, Suparna Mondal. The recording, editing, voice and sound processing of this whole project has been done by me. Now let us jump into the video. Breast milk is unquestionably the best food for the baby. And successful breastfeeding is an important child rearing skill to be learned and practiced properly. After delivery, the first 2 to 3 days, a special yellowish milk is secreted in small amount which is sufficient for the baby. This type of milk is called colostrum. Next comes transitional milk and then matured milk. One feeding, 2 types of milk is secreted. First comes fore milk, which is more watery and contains more lactose, protein, vitamins and minerals. Then hind milk or late milk comes, which is richer in fat, provides more energy and satisfy the baby's hunger. Colostrum helps to build a strong immune system, coating on baby's stomach and intestines to keep germs from causing illness. Moreover, colostrum contains bifidus factor, which encourages lactobacilli to grow in the small intestine, thus establishes the microbiota in the gut. Colostrum also acts as a laxative to help the baby to pass the dark first stool. It also helps to prevent jaundice. It gives the baby DHA, vitamin A, D, E, K, which are needed for the optimal brain development. Colostrum as well as human milk contains the nutrients in easily digestible form. Colostrum also helps to prevent low blood sugar in newborns. You can find the composition of colostrum and human milk in this video. Now hop on to the benefits of breastfeeding for the baby. Breastfeeding protects the baby against infection and inflammation by supporting the baby's developing immune system. Breastfeeding lowers the risk of respiratory infection, especially lower respiratory tract infection, pneumonia, etc. Breastfeeding also lowers the risk of sudden infant death syndrome, risk of ear infection, gastroenteritis, allergies, and also lowers the risk of obesity and diabetes mellitus in future. DHA and other essential nutrients present in breast milk optimizes the brain development and enhances the cognitive function development. Breastfeeding also leads to optimal oral development and reduces tooth decay in later life. Breastfeeding also strengthens the bond between the mother and the child. Now comes benefits of breastfeeding for the mother. Breastfeeding burns extra calories that reduces the pregnancy weight faster. Breastfeeding releases 2 magic hormones in our body from pituitary gland, which are oxytocin and prolactin. Oxytocin helps the uterus to get back to its normal size faster and reduces uterus bleeding. It also helps the milk to be ejected from the alveoli of mammary gland. Prolactin hormone increases milk production in the mammary gland. Prolactin hormone and other factors prevents pregnancy, thus provides natural contraception protection. breastfed babies have a better sleep patterns so that the mother also can sleep better. Moreover, breastfeeding helps you to save money as no infant formula is needed to be bought. Breastfeeding also reduces the risk of type 2 diabetes mellitus, breast cancer, ovarian and uterine cancer, and postpartum depression. Now this is time to know how and when to feed the baby properly. The baby may receive the first feed soon after birth, preferably within 30 minutes after birth. Even babies delivered by cesarean section are breastfed within 2 to 4 hours after birth. Proper technique is necessary to feed the baby properly. The techniques include proper attachment, proper positioning, and effective suckling. For proper attachment, the chin of the baby should be touching your breast, mouth should be wide open, lower lip turned outwards, and more areola visible above than below the mouth. Now time for positioning. The infant's head and body should be straight. The infant should be facing the breast with his nose opposite to the nipple. Infant's body should be close to the mother's body. The mother should not support the infant's shoulders and neck only, but also she should support the infant's whole body with her hands, arms, and maybe with the help of pillow. So now time to know how can we assess if the baby is feeding properly or not. We can assume that baby is feeding properly when slow, deep sucks are followed with pause for swallowing the milk. The signs that indicate that the feeding is not going on proper way may include milk leakage, clicking sound, no swallowing sound at all. So you must be careful while feeding your baby. All mothers should follow the cues to feed their baby while the baby is hungry. The cues may include opening of mouth, sticking out the tongue, sucking on hands, and crying is a late sign of hunger. So then you may calm the baby first and then offer your breast. Now it is time for knowing what artificial feeding is, the reasons behind it, and comparison between breastfeeding and artificial feeding. There are various reasons behind artificial feeding. Some are serious illness like septicemia of the mother, another pregnancy during lactation, or the child is too weak to suck the milk, insufficient milk for the child, mother absent to feed the child, or mother is on anticoagulants, steroids, or any kind of radioactive drugs, or if the mother is dead, then artificial feeding is the only option left. Breastfeeding should always be the first option for the baby. Breast milk contains all the nutrients in easily digestible form. It contains lipase enzyme which helps in fat digestion, and essential fatty acids like DHA and EPA which helps in brain development. But cow's milk lacks the lipase enzyme and essential fatty acids. Breast milk contains more whey protein, less casein than cow's milk, which is good for the baby. Moreover, there is more lactose in breast milk than cow's milk. Secretory immunoglobulin A or IgA is present in breast milk, which supports the immune system of the baby, but it is absent in cow's milk. Moreover, human milk contains more vitamin C and more vitamin A than the cow's milk. Thus, human milk is always the best option for human baby. All the nutrients are present in breast milk in apt and appropriate proportion for the baby, which he can well tolerate. Breast milk does not need more containers, more packaging, thus it is eco-friendly than artificial feeding. Moreover, breast milk helps you to save more money. Nowadays, WHO, World Health Organization, is recommending to breastfeed a baby even if the mother is COVID-19 suspected or a confirmed patient. In some rare cases of septicemia where bacteria might reach the breast milk, then the artificial feeding should be the choice of feeding. Myths have been always there in our lives. Breastfeeding is nothing exceptional. Caffeine present in tea, coffee does not affect the baby's system, but excess consumption can cause harm to the baby. Theobromine in chocolate is similar to caffeine. Only excess consumption can cause harm. Many mothers are told to avoid spicy foods because these foods are thought to cause colic, gas, diarrhea, and rashes in the breastfeeding infant. However, strong flavors such as garlic can change the smell and flavor of the breast milk, but this does not usually make infants fuzzier. Garlic extract tend to feed for a longer time and seem to prefer a variety of flavors in breast milk, which might facilitate weaning to solid foods. It is common for the mothers to be warned to avoid gassy foods such as cabbage, cauliflower, and broccoli. Eating such foods can cause gas in the mother's bowel. However, gas and fiber do not pass into the breast milk. Moreover, consumption of raw foods by nursing mothers does not pose a serious problem to the breastfeeding infants. But there is a potential for the mother to suffer from food poisoning. In general, maternal food poisoning does not result in infection in infants, except in rare cases of septicemia, where bacteria might reach the breast milk. Even in severe septicemia, there is no need to discontinue breastfeeding if the mother is treated with appropriate antibiotics. Breastfeeding mothers in non-Western cultures are advised to avoid cold foods to maintain a warm temperature within the body. However, the temperature of breast milk is similar to body temperature and is well maintained through the thermoregulation of the mother's body. There have been no reports of cold foods affecting the production or quality of breast milk. Many mothers believed that drinking a lot of fluids was helpful in increasing breast milk production. However, fluid intake during lactation does not affect milk volume. Drink to thirst is the best guide for how much liquid a breastfeeding mother should drink. Drinking 25% more fluid than the drink to thirst recommendation actually resulted in a slightly decreased milk supply. Now time for some nutritional tips for the lactating mother. Maternal diets can affect the composition of fatty acids of breast milk but does not change the total milk fat content. The amount of fat in breast milk changes during each feeding and throughout the day. The diet of breastfeeding mothers should include adequate polyunsaturated fatty acids. Docosahexaenoic acid or DHA is critically important for visual acuity and neural development of the baby. Maternal DHA intake through consumption of fish and seafood increases the level of DHA in breast milk. Trans fatty acids in breast milk could negatively affect the infant's growth and development of the baby. The World Health Organization recommends that trans fats be limited to less than 1% of overall energy intake. Some most common foods containing trans fatty acids are bakery items, snacks, fast food products, and margarine. Some foods are known to increase milk production. They are called galactagogue foods, and some foods inhibit the milk production. They are called anti-galactagogue foods. Some galactagogue foods and anti-galactagogue foods have been listed in this video. Alcohol consumption is bad for both mother and baby. It interferes with the development of baby. Smoking causes nicotine in breast milk, which interferes with the development of baby. For conclusion, we can say breast milk is the best nutrition for infant growth and development. In preterm or low birth weight newborns, a mother's own milk is the first choice for preterm infants. When it is unavailable, donor breast milk is considered as the next best choice. Whichever way mothers choose to feed their baby, breast milk, formula, or a combination of both, the most important thing is that the baby is well fed, well cared for, and loved. That's all for today. If you find this video helpful, then please share with your near and dear ones to make them aware about breastfeeding. And hit the like button and don't forget to subscribe to my channel. Thank you for watching. Stay home, stay safe. Bye.